Well, hello there again. I am back on here to talk about a different topic. Something I had briefly mentioned earlier in my last video. I want to talk about the labels and the names that everybody, scientists, medical professionals, regular citizens, government officials, politicians, everybody, have been talking with these different labels and names for what is this pandemic is, coronavirus, COVID-19, SARS-CoV-2, okay? You got multiple names going on with this, and it can get a little confusing. I was actually talking about this with my father-in-law yesterday, and I had mentioned the name SARS-CoV-2, and he said, I've never heard of that. Now this man watches news all day, reads news, and I was very surprised that he hadn't heard that, okay? So I kind of, had broke it down to him, what it actually stands for. Now, so you take coronavirus, okay? Coronavirus itself is a virus. Now, what is a virus? A virus is a genetically made up kind of computer data, so to say, with protein crowns on the outside, okay? Now, that coronavirus, that virus itself, wants a host. So wants a healthy host, human body, okay? When that coronavirus gets into your body and merges with your body and starts to infect and create more of an infection within you, you now have COVID-19, which was produced from the coronavirus being put into your body somehow, some way, okay? Droplets, grabbing something, wiping your hands on your face, somehow, some way, okay? So keep that in mind. Yeah, you can get coronavirus. And then, like, you hear them say, oh, he contracted coronavirus. Oh, he died of COVID-19. Coronavirus didn't kill him. COVID-19 did. But now, there's this new label out there. It's kind of briefly talked about. It's a little bit longer to say. It's called SARS-CoV-2. All right? Now, what is SARS? Remember SARS? It happened in China some years ago. And SARS stands for Severe Acute Respiratory Syndrome. All right? Now, this coronavirus, when it when gotten into the body, goes directly for the lungs, goes for the receptors within the lungs, and once the receptors on that coronavirus to attach to the receptors in your lungs. I talked about this in another video where I was talking about the difference between the influenza molecule and the coronavirus molecule. And what I was saying in that video, and I'll say it again, is that if you take the influenza molecule, okay, first and foremost, it's a lot smaller and does not do as much damage fatally, so to say, as coronavirus. Now, the other thing too is the molecule for influenza is very, very similar to that of a coronavirus. Just size is a lot different. And then one major fact is that the influenza molecule has a coating around it, like a slimy type of coating, that those little spiky things, those are the crowns, the receptors. Those receptors want to get to the receptors in your lungs, like I just said. Now, if there is like a jelly around those, it makes it harder for those receptors to reach and react to your receptors. That's why you can get introduced with the influenza molecule and not get the flu, okay? But with coronavirus, the virus itself, the molecule, has those crowns just like influenza, but it does not have that coating around it that stops and kind of lessens those receptors, because there's like a jelly in between them, influenza and your receptors, so they're not going to click up so well. But in a coronavirus, that receptor is wide open and out in the open, doesn't have that coating around it, so it is more susceptible to attaching to the receptor within your lungs. All right, and then your lungs suck it in, and now it morphs, and that's when you can now call it COVID-19. All right, but now everybody's calling it SARS-CoV-2. Reason for this is they're noticing, because you get pneumonia type symptoms, people are dying, and people are showing the same symptoms and outcomes and diagnoses and everything that was happening when the original SARS outbreak had happened. Severe acute respiratory syndrome, right? Now, Dr. Fauci said on the Laura Ingraham show the other day on Fox, Fauci put her down because she was trying to compare influenza to coronavirus and trying to say that they are pretty much the same. Fauci debunked her and explained to her they are not the same. And I just explained to you how they are not the same. Okay? And then Fauci went along to say that with this SARS-CoV-2, look at how they put the word SARS in there now. Fauci went ahead and was saying that when SARS was around, that they had started working on a vaccine. They had started working on some form of a treatment product, right? They didn't even need to go into full clinical trials with it. And Dr. Fauci himself even said it just disappeared. That's hard to believe. It's hard to swallow when somebody says that, a virus just disappeared, I personally, I don't have any facts to back this up. This is a personal opinion. I don't think SARS when SARS originally came out, I don't think it ever disappeared. I'm wondering if maybe it was just still here and we kind of contained it, or we, our bodies kind of made the antibodies and we got used to it, okay? I might be wrong. I don't know. But how I look at it now is when you're calling it SARS-CoV-2, you're kind of letting me know and kind of telling me SARS is back, bitch. Not only is SARS back, but it's got a friend. And that friend is coronavirus. So you got SARS, severe acute respiratory syndrome, mixed with the molecule and the virus of coronavirus. What do you call it? SARS-CoV-2. This is the second form of SARS. It's not that hard to fathom and comprehend. Medical professional scientists are even going back to when they were working on that vaccine for the original SARS outbreak. And they're trying to go back in their files and trying to see, what were they using to fight, what were they going to use to fight that SARS outbreak? Can they use it for this? Can they use it and maybe modify a little bit, tweak it, put a different, they're talking with this hydroxychloroquine, they're talking about this RISP or something, whatever it's called, maybe mixing these medications and now coming up with a viable antibiotic and or vaccine, right? But if you notice, and if you really look, you're not going to hear any of what I'm saying right now on the mainstream media, CNN, MSNBC, Fox News, those three stations. You ain't hearing nothing of what I'm talking about right now. You got to dig deep for what I'm telling you right now. Do some real research. And that's the problem too. They just keep throwing out these terms. And all these people, okay, regular citizens, like myself, people I live with, just regular, everyday, average Joe citizens, it kind of confuses them, You sit around and you tell somebody, you don't know what to call it. And then as well, when the media or the politicians use these different terms, not only is it confusing to the public, you got a politician up there one day saying coronavirus, 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 coronavirus. And then the next day saying COVID-19, COVID-19, COVID-19. And then 2 days after that, they start calling it SARS-CoV-2. What is this? Is it the same thing? Or are these three different viruses and three different things that we're fighting right now? People will get confused. So we need to stick with one term. One one type of terminology that describes this, and then go from there and figure out why do we call it that. Like I'm breaking down now. Why is it called SARS-CoV-2? Just told you. Because it is a form of SARS mixed with the coronavirus. And then you put the number 2 on the end because it's the second wave of SARS. And that's what they're not telling you on all these mainstream media networks and outlets. You gotta dig deep. And don't be a sheep. You gotta, lead by example. We need to, as citizens, do our own research and educate ourselves before we, start talking about these things the way these politicians do. Some of these medical professionals, like with my last video talking about Dr. Phil and Dr. Oz, you need to listen to the true medical and scientist professionals. Dr. Fauci, Dr. Peter Hotez, Dr. Michael Osterholm, okay? Those 3 gentlemen, I love listening to them. They tell you the straight skinny. They will give you a statistic, and then they will back that statistic up with a reasoning for why they gave you that statistic. And like I think I've said this before on a couple of interviews, the problem that we have on a political spectrum right now, too, is that you have Dr. Fauci, who is great at what he does. I'm not taking anything away from this individual. He's great at what he does, okay? But he is very reserved. He goes up on that podium, he spits out some statistics, he spits out some truth, and then changes the subject. You'll say, oh, we have a projection of possibly 100 to 200,000 Americans dying from this, and then going right into another subject. Although still on the pandemic, but another by portion of that subject. Not giving a reasoning or a proper form of why you came up with that number. And the reason for that, the reason Dr. Fauci is being so reserved up on that podium, I've said this before, is because he has the president and the president's administration right there behind him, looking down his neck. I mean, you look at the one interview, they asked him a question about adequate testing, and the President, Trump, walked in front of him and over 2 feet to stand in front of the podium and berated and yelled at the reporters, yelling at them, you've asked this question 15, 20 times already. He's not going to answer that. There's no reason to answer that. Reserved because he has to be reserved, as well as he has an administration that is putting a gag on him. Unfortunately, the one man who is trying to help save us and help save our country, our president, our president's administration, our federal government, puts a gag in that man's mouth. And unfortunately, that man is Anthony Fauci, who I have a great deal of respect for. Now, Anthony Fauci, Peter Hotez, and Michael Osterholm, they all know each other. I believe they all worked together in the pandemic group during the Obama administration. I mean, Fauci has worked for 6 different presidents over the years. And you get the same information from the other 2 doctors that I was talking about. You get the same information from them, but they will give you an explanation as to why they said what they said. Okay? And you just, please, people, be educated. Educate yourselves. This is not going away anytime soon either. And that's the problem. And here in this country, we have too much bickering on a political level. We have too much tit for tat. Who did this? Who's doing that? Who's going to open up their state? Who's going to open up restaurants? Who's going to open this? How am I going to open this? And I'll say it again and again and again. I personally feel that you cannot open up anything. Schools, stadiums, certain businesses, certain businesses you probably could open if you minimize the amount of individuals that were conducting business and whatnot. Excuse me. Take tattooing, for instance. Okay, I've been a tattoo artist for 20 years. They're trying to do a soft open for tattoo shops where you're only going to have the artist and the client in there at one time. Not going to be able to have, walk-ins and stuff. Predominantly, a lot of tattooing in the industry is all done by appointment. Deposits put down, the appointment stuff. You get people walking in, but not as much as you did years and years ago. Nowadays, you got people that have schedules and they want to keep their schedules, so they make an appointment and they drop a deposit. That's how the tattoo industry really works, okay? Plus, you have the tattoo conventions and you have tattoo artists that travel across the country to do guest spots in other professional shops and stuff. But if we, as a community, tattoo community, if we could, do this soft open and only allow an artist and a client in the building, or a lot of tattoo shops have their own booth with a door and stuff. Individual booths for these artists. Same thing with hairdressing. Some of these places have individual booths. Not all hairdresser, not all tattoo shops are like a galley where it's all open. That is running a risk, in my opinion. Maybe we could start opening up restaurants and limit the amount of tables that are provided in the restaurant. Yeah, it's going to cut down on revenue for that restaurant, but at least that restaurant is creating some form of revenue. If a restaurant has normally 25 tables, lower it down to 12, 10. Yeah, you're going to take a hit when you open up, but would you rather take a small financial hit or a huge financial hit, and or a huge financial hit with a health crisis in your business? You have weighed the options. Look at what you're doing. I kind of got off subject. I was talking about, the terminology of coronavirus, COVID-19, SARS-CoV-2. I think I got my point across with that. I hope I did. It's the bickering. The bickering between politicians and just everybody on a high level. They're supposed to be stepping up. You're supposed to step up and help us as citizens. You're supposed to step up and help our healthcare workers. Above all, like I said in another video, this is a war of sorts. And the soldiers that are on the front lines right now are our doctors and our nurses. And first responders, police, fire, anybody who is helping someone go through this or not contract this, I call you, you're on the front line. You're a hero to me. And, just kind of running out of things to say. And go grab another cup of coffee in a minute. Get my day started. Just going on and on. Oh, excuse me. I watched a great podcast yesterday. Joe Rogan. Watch his podcast for pretty much all the time. If I don't watch it the day he puts it out, I'll watch it the next day. It was Rogan and Donnell Rollins. Okay? And great. I only was going to sit down and watch about an hour to an hour and a half of it. It was a 3-hour long podcast. I was only going to watch about an hour, hour and a half, and then go to bed with my wife. I wound up staying up watching the whole entire thing because I was so intrigued on some of the things that they were talking about. And Joe Rogan himself had said something that I have not even actually thought of with everything I've been doing since this pandemic, all the research and all the different categories of research I'm doing. I'm looking at, the financials aspects of this, the military aspects of this, the political aspects of this, the terminology aspects, the medical, the scientific, just the human factor aspects of just all of this with this pandemic. There is not one human being on this earth there's not one human being on this earth that is immune to being affected by this. You may not contract it, but you may know someone who does, and that will affect you. It may be a friend, it may be a family member. You yourself may not get it. You yourself may have already had it, got over it quick, you got antibodies for it now. But your mom, your grandma, your brother, sister, kids, whatever, might not be as lucky. And so Joe Rogan was saying about how, we pay our taxes. Okay? Taxes come out of our paychecks on a federal level. If we're paying our taxes for all these years, why is it now that when we need the federal government the most to help us create a more sustained and secured medical field, medical field for us, the citizens, it's not being done? You can't just walk in somewhere and say, hey, I have this cough, I think I need to get tested. No, you have to go into the facility, sit down in the ER with everybody else sneezing and coughing. You're going to wind up getting it. You go get tested, you're going to wind up getting it. You stay at home, you got symptoms, you don't have an oxygen meter, you don't have a ventilator at home, you're scared shitless, you don't know what to do, you can't go to the store now because you think you might have it, but yet you don't have cases of water at your house, you don't have enough food at your house to quarantine, and if you get sick enough, you're definitely not going to be able to go to the store. So it's I agree with what Rogan was saying when, he's saying that, when we pay our taxes, where is the federal government on this? They need to really step up. I think, with the Defense Production Act, I think we are and have been missing the ball like crazy. I had a great idea when I saw on the news that healthcare workers on the front lines, nurses and doctors, are taking hefty trash bags, and just trash bags in general, poking some holes in them for their arms and using these as ponchos now. Okay? Great idea. I've used trash bags as ponchos in the rain before. Okay? Great fucking idea. An even better idea would be if one of these trash bag companies like Hefty, Glad, any of them, maybe reconfigured a couple machines to create actual ponchos or aprons or something for these frontline workers so that they don't have to convert trash bags on their own. Why? I've told that to a couple people. They said, that's a great idea. I said, I know it is. I know it fucking is. I said it. I know it's a great idea. Just like there's a lot of people, a lot of individuals, a lot of citizens out there that are creating masks on their own, giving them out. They'll make 150 masks and then they'll go donate it to their local hospital or their local hotspot or their local triage tent, parking lot somewhere or something. As noble, way noble and commendable. And my hat's off to you for that. But I think on a more corporate and broader spectrum, take New Era. Okay? New Era. The people that make baseball, basketball hats, fitted hats and everything, okay? New Era, you could stop making hats and maybe start using your fabric to make masks. A guy out here in New Mexico, Iranian student, he goes to college out here, I think UNM, for scientific something has to do with science, and he created a motorized plug-in-the-wall ventilator out of PVC pipe, and it's a spin, and it goes like this, and it just pumps this bag, and it is ingenious. And it cost him, I think they said less than, I think they said they cost him less than $50 to make this thing. Less than $50 to go to the store, buy everything he needed to buy and make this thing. Right? But we got federal government arguing with governors about getting ventilators made. And these ventilators are going to cost hundreds of thousands of dollars. And this guy made one for less than $50. Now he's going to take his prototype and he's going to take it into the science lab at UNM. He's going to probably work with another scientist that he works with, and he's going to try to put some finishing touches on it and try to make it so that he can create this on a broader spectrum, so that he could donate this to other hospitals and things like that. He made a YouTube video showing you exactly how to make this ventilator step by step if you would need a ventilator, or if you want to have one on site just in case. You know, this is what we need. We need camaraderie. We need people to come together. None of this partisan split between political lines, racial lines, economic lines. We, at this point right now, cannot be separated. We need to stand as one human race. Who cares if you're white, African American, Latino American, Asian American, gay, lesbian, trans, bi, straight? It doesn't matter. Because if we cut ourselves, we all bleed red. We all bleed the same blood, and we all die the same way. We all come into this world the same fucking way. We need to put our differences aside and work together on the things that we know we can coincide and agree on. And one thing that we can definitely agree on as human beings, in my opinion, is that we need to eradicate or find some medium to mitigate and get rid of this SARS-CoV-2. They could have done it back in the early 2000s when the original SARS had come out, but political officials and whatnot said, oh, it disappeared. I guess we don't need to fund that part of the pandemic unit anymore. Guess we don't need to fund a vaccine anymore. Guess we don't need to fund a antibiotic or any type of testing for the original SARS outbreak. And yeah, it came back and it's biting us in the ass now, isn't it? And not only is it biting us in the ass, but we, even the media, some of the media I should say, because I remember I said this isn't on mainstream media, they're blatantly putting it in your face, and you're not realizing it. I'm not saying the citizens and people are stupid or anything by any means. I'm just saying that we're naive. We are conditioned to want to sit back and be told what to think and not completely think for ourselves in these times, in this era of life, in this era of time, okay? Especially during this pandemic. People sit there and they look, they watch the TV and they listen to Trump spew all these fucking lies and not let the medical professionals talk, and they use that as their information. That is not information. That is misinformation by a mentally challenged president. He is mentally challenged at his age, possibly onset Alzheimer's, dementia, something to that nature. Something's going on up there in that head. And it's not pretty, especially when the lies start popping out with no regard for personal or human compassion, empathy, truth, any of them. It's like I've said before, it's appalling. I'm going to keep saying that. Appalling. It's motherfucking appalling. But I'm going to repeat myself really quick for any of the people who may just be trying to check out, and I don't know. SARS-CoV-2. When the mainstream media, whatever you watch, Fox, CNN, MSNBC, your local news, whatever, when the mainstream media starts pushing that identity for this virus more and more, you're gonna hear that label, SARS-CoV-2. And I said I'll break it down for you again. You had SARS back in the early 2000s. SARS stands for Severe Acute Respiratory Syndrome. SARS miraculously disappeared. Doesn't that sound like our president a couple months ago? So miraculously disappeared. Like, no. I personally, I'm not a medical professional, I'm not a scientist, I just do lots of research on my own because I'm not a sheep to be led to the herd to be slaughtered, okay? But, you know, to know, I don't think SARS ever actually left us. And I think we are now gonna have to bite the big one. We're, deaths, cases, and just, yeah, okay, coronavirus, okay. See, the original SARS, when it came out, that too, it's not a coronavirus based disease. Influenza, H1N1, MERS, Ebola, and there's another one, and now this one. There's 5 different types of coronaviruses, okay. This is the 5th, all right. But SARS was not labeled a coronavirus. It was just labeled as severe acute respiratory syndrome, SARS. Like I had said before, they took that and mixed it with COVID-19, and now you have the name SARS-CoV-2. Why 2? Because it's the second outbreak of SARS, just mixed with a molecule called the coronavirus, which in turn in your body turns into COVID-19. And then helps produce SARS and giving you a severe acute respiratory syndrome. I hope I was informative today about these identities and things. I kind of rambled a little bit on there. Yeah, I just want everybody to be informed, know what's going on out there, and find out these terminologies, these words, and you use them, know them. Don't be blind just following what everybody says. Don't be blind doing whatever, everybody else is doing and you're just following behind. Because when you follow blindly, you're going to get let off a cliff. And when you get let off a cliff, you fall and die. You need to take the blindfold off, stop walking, look down, and realize where you're at. And start to make decisions, start to make educated assumptions and whatnot by finding facts, finding, proper terminology, proper factual theories, things like that. Yeah. Well, I guess I'm going to close this one off. About 35 minutes now. I only wanted to do about 15. Me and my damn rambling ass. Really quick, like I've been doing on almost every video, if you want to donate anything to help the frontline workers, your nurses and doctors in the hot spots, New York, New Jersey, Philadelphia, Pennsylvania, Michigan, Detroit, Michigan, Baton Rouge, Louisiana, San Francisco, California, Seattle, Washington, Navajo Nation out here in New Mexico, where the hot spots are per state around the country. If you want to donate anything, go look up redcross.org. Make a donation, and they are taking the donations and flipping them back over to the healthcare workers on the front line, nurses, doctors, first responders. They're helping them to get masks, gloves, aprons, face shields, PPE in general, food, if they can and whatnot, try to get them adequate housing and like hotels and stuff. Some of these people, they take my sister, for instance. My sister had gotten an email or phone call or something, whatever, from some government official of some sort in the medical field, and because my sister's a nurse, and they had offered her $63 an hour to go out to a field hospital in Atlantic City, New Jersey. Now, she lives right outside Philadelphia, Pennsylvania. You're talking hour or 2 drive. Would you really want to do that every day? No. That's why a lot of these nurses and doctors are sleeping in their cars. They can't get into the hotel rooms. The hotel rooms are on lockdown and stuff like that. So what's the next best bet? Sleep in your car. If all the restaurants and everything are closed, where are you getting food from? What, vending machines? So that's why, we got people and organizations like redcross.org to step in and try to help these individuals. And about my sister, getting offered the 63 an hour to go up there, she declined on that. I guess she looked at it and weighed out the pros and cons of what is going on, and she, decided not to. She already has a job and she's still working, so it's not like she's unemployed or anything. I mean, she's still doing her thing, nursing. Just not out there on the front lines at one of these, triage spots or field hospital they call it. So, but yes, if you want to donate, because that's our heroes right now, wear gloves, masks, and gowns, not fatigues and guns. Our frontline soldiers right now are male and female nurses, and male and female doctors, male and female police officers, male and female firefighters, male and female first responders. They are the true heroes right now that go out there every day to face an unseen enemy. They don't know where this is coming from. It could be the person next to them. It could be the person across the street crossing the street to walk past them and coughs. We don't have a visual on this. And that within itself is extremely disturbing. These healthcare workers are 100% heroes. They are 100% soldiers on a front line of a war that has an enemy with no face. So yes, anyone wanting to donate to help these heroes in this time of need during this pandemic, go to redcross.org. Make a donation, please. Thank you. Anybody that likes this, please subscribe. Please share the videos. Got questions, concerns, comments? Put them down at the bottom. I know Joe Rogan says, don't read the comments, don't read the comments. I don't really get that many, so I'll read them here and there if I do get them. I'd rather talk to some people and see if I can help people through this, maybe with quality information or quality information on what's going on, or I can help with, trying to, if people out there need stuff, you need, masks for your family and stuff. I know some people out here that are making them. We contact you with them, you get them mailed out. I want to help anybody and everybody that I can during this. Right now I got to worry about 7 people in my home, 8 including me. Diabetics, cancer patient, 2 twin 7-year-old daughters. I got a lot on my plate here, but I have no problem with broadening my spectrum on trying to help individuals. That's why I'm doing this every day, putting a video out, talking about different things that I think people do have on their mind. There probably are some people out there that, they'll watch this video and think to themselves, wow, I was wondering why they were calling it coronavirus, then COVID-19, now they're saying it's called SARS COV2. Yeah, it gets confusing. And they do that on purpose. They do, the media, politicians and everything, they do that on purpose. They do that on purpose so that they can purposely deflect. They can purposely confuse you and make you start thinking about that rather than thinking about what is really necessary, essential, and at hand. It's a deflection. It's just another way to deflect what is exactly going on and what the real truth is and what's going on. So I just, I want to try to expose, maybe to bring an enlightenment to some of the things that are going on during this pandemic. This is unprecedented. I'm 41 years old. I've never seen anything like this on a global spectrum like this. I mean, yeah, I was around for SARS, Ebola, when that came out. That was primarily contained in Africa. And WHO and everybody, they got a lid on that quick. AIDS, the AIDS epidemic, that was pretty big. I remember that in the 80s. I was young, but I do remember that. I remember a lot about that. And that was a lot different from this, though. You had to physically do something with somebody in order to contract HIV. You had to share a needle. You had to have unprotected sex, whether, hetero or homosexually. It didn't matter. And like I said, you needed that blood on blood physical contact. Whereas this, anybody can get it at any time just because someone sneezed or coughed or didn't wash their hand and grabbed the doorknob. I remember when the epidemic of AIDS was around, and people were asking questions like, oh, can I get it on a toilet seat if I sit on the same toilet seat as somebody? If I touch the same doorknob, can I get it? People were, yeah and no, and it was all a bunch of, misinformation, deflect, say something different. And then they did the same thing as they're doing now when it came to that. And then it just came out then some truths came out, with this. And the big difference with the AIDS epidemic and this too, on a political level spectrum, is that eventually the government, politicians, they came around, and they were saying, we need to research this, listen to the medical professionals, and find out exactly how is this contracted, who does this affect, this and that. Okay, that's when they came out with the truths. It has to be blood on blood contact, semen, this and that. You can't just get it from sitting on a toilet seat. That's when the truths started coming out. Was it a little bit late? A little bit, yes. Because within the misinformation came hatred, came a form of xenophobia, bigotry towards, especially homosexual individuals, gay and lesbian. It turned into be the gay cancer, they called it, and now look at what's going on with this. They're finding out with SARS-CoV-2, they're finding out, that African American people are more susceptible to getting it. People who drink alcohol are more susceptible to getting it. People of, obese people more susceptible to getting it. Diabetics, this, that, whatever. So there's no one set of individuals that you could say get it, but you can see the lines divided through race and culture, where this, look at what's going on with the African American community. More African Americans are fatally dying from this than Caucasians. Latinos, they got a pretty high fatality rate too. But to compare African Americans to Caucasians for this, yeah, Caucasians are getting it. Yes, they're dying, but for some reason, African Americans are contracting it faster, more widespread, and more African Americans have died from this. Could it be the predispositions? A lot of African Americans are already predisposed to diabetes, for instance. Things like, that, high blood pressure. African Americans are more susceptible to getting high blood pressure and having heart problems than Caucasians. Is that possibly what's doing this? But then what we're doing as citizens, we're doing it in the media, we're doing it politically. We put that wedge in the middle and create that divide, and that wedge and that divide is the word racism. And we are, black man coughing, sneezing, goes into a hospital, can't get a test. White man goes in, sneezing, coughing, give him a test right away. That's not fair. A citizen is a citizen. What if that white man mooches off of his parents, lives in his parents' basement, he's like 30, 40 years old, barely ever worked a day in his life, sits around playing PlayStation and games all the time, okay? The dude is a waste of life, but because of his skin color, he got in to get tested? When you could take the African American, maybe that man has been working since he was 12, 13 years old, pays his taxes every year like a good citizen does, enlisted into the military at 18 after high school, after graduating high school as an African American man in the United States. Puts in his time, in that military, protecting, fighting, and serving the the American people and the right and the freedom of democracy. And we, as a society, as a medical society and profession, or politicians too, you're going to have this rhetoric and or just straight bigotry to where you're gonna admit the white man in to get tested, the loser, low life white man in to get tested, but you're not gonna back and help out your tax paying citizen veteran who donated and risked his life for this country. This is where we need to stop drawing those lines. We need to come together. Yeah. So, alright, well, I'm going to cut this one off. I've been bullshitting on here for 45 minutes. So, but remember, if you want to donate anything, if you're able to, I know financial times are hard now too as well. So I'm not telling anybody to donate. I'm just saying if you're going to donate, why not pick the redcross.org. Okay? Thank you very much for watching. If you enjoyed this, please feel free to subscribe. Leave me some comments, questions, share videos, anything of that nature. Really appreciate you watching. I hope everyone out there stays safe, stays clean, and stop shaking hands. Alright, you guys all have a great day. Notes is out.